problems getting pregnant, problems during pregnancy, problems in labor and delivery, and problems postpartum. There are a lot of opportunities for challenges to arise in the process of trying to or having a child. Rapidly declining sperm count in men, rapid increase in interventions during birth, increase in mental health struggles for postpartum moms. These are just a few examples of the challenges moms and dads face in the process of growing their families. Do you know anyone who has experienced these? Do you wonder why these are growing problems? Dr. Nicole McCauley joins me today to talk through some of these challenges and how she is helping her patients in the midst of it all. As a chiropractic pediatric diplomat and an international board-certified lactation consultant, she brings a lot of expertise and wisdom to the discussion. If you're not in one of these stages yourself, you'll want to listen in to be a better friend when others are experiencing these challenges that we discuss. And you'll want to share this emotional and encouraging episode with people in your life who are in these stages and could use some hope. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. So this is a place where you can learn about healthy living and take the next step in your wellness journey. Dr. McCauley, thank you for joining us on the Daily Wellness Podcast.
Thanks for having me.
Yeah, I'm so excited. I think you have tons of things that are just so valuable for women to know. I had a hard time after I was looking at your website and all the things that you do. I was like, we could talk about so many things. I was having a hard time narrowing it down. And so we chatted just before this. And so I think we have a plan here. But before we get into that, can you kind of share a little bit about yourself and why you do what you do?
Absolutely. Thank you. So I'm Dr. Nicole McCauley, and I own Breath of Life Pregnancy and Pediatric Chiropractic. I absolutely love what I do. And one of the reasons why I'm so passionate about it is because it's part of my story. It's part of who I am. So when my great-grandparents were trying to get pregnant, it took them a very long time. It took 7 years. And they were just having a big struggle, couldn't figure out what was going on. And so my great-grandma was in her quilting circle one day at church, and she was just, crying out to these ladies, what can I do? What can I do? Joe's about to leave me because I can't give him any babies. And, we have this farm, and what am I going to do? And so her friend's like, honey, go see a chiropractor. They'll get you pregnant. Just like that. And so my great-grandma, Viola, was like, well, I'd really like to have a baby with Joe, but at this point, she's like, no, it's not like that. Anyhow, both my great-grandma and my great-grandpa went to see a chiropractor, and he wouldn't see her without him, thank goodness, because I was very smart. It takes two to tango. And in addressing that, we found out he was the one who was having challenges in that area. So they were able to correct that. About 2 months later, they got pregnant with my grandma and never saw a chiropractor again because they thought pregnancy was the only thing chiropractic did.
Wow.
They lived across the street from a chiropractor. So funny. So then my mom had a miscarriage after she had my sister. And my great-grandma pulled her aside and said the story. And no one had heard the story before. And so she told her everything that happened. And she said, go see a chiropractor. They can help. And so my mom went to go see a chiropractor and brought my father along. And they were under care. About 6 weeks later, here I am. So I come along. It's pretty fantastic. That chiropractor said, well, it's about the nervous system. It's not about getting pregnant. But I'm glad you're here.
Yeah.
Anyway, they were under care. I was under care through the whole pregnancy with my mom. And then on the way home from the hospital, she took me to go see him. So I went there before I went home, and it's always been a part of my life. So I never knew it was anything different. I thought everybody went to go see a chiropractor. And I lived in both worlds. My mom's a nurse. So I had, pills and shots and inhalers for many things growing up. And I had natural health care too. And we just used different things for different issues depending on what the situation called for. And as I grew into making decisions for myself, this made more sense to me, and I wanted to focus more on that. There's time and place for everything. I really want to stress that. But this is definitely where my heart lives and how I wanted to serve and help people. So I knew from the time I was 17, I wanted to do this. And I went to Palmer College, which is where I ended up going to chiropractic school. But I went there to visit, and there was a doctor reunion that was going on there. And this doctor who had not been back to Palmer since he graduated showed up there. And guess what? He was the one who helped my mom and my dad get pregnant with me. So I got to meet my chiropractor that helped me come into existence. It was a pretty neat thing.
Wow,
And
what a legacy story.
so that's where I went, and I was focused. That's exactly what I wanted to do with my life. And here I am, and I'm almost 20 years in, and it's so much fun. I come to work today every day just with the same amount of passion, if not more. It's so much fun. I get to play with babies all day. I don't have to change diapers. It's amazing.
You found your calling in life.
It's a blast.
Yeah. Wow, that's amazing. Like, I just can't believe all the little details of how that story tied together. And it's really funny to think back on your great-grandparents and the misconception of chiropractors, because I think there's still a lot of misconceptions, maybe not quite the same, but definitely still some. Wow.
It's so funny to me. I mean, like now, most people have no idea that we can be helpful with things other than back pain. Like that's the pigeonhole we've been put in. And so when they find out that I take care of babies or I take care of pregnant women, they're like, why would a baby ever want to come to a chiropractor? Like, would a pregnant woman do that? And I'm like, I'm so glad you asked.
Yes.
It's a great opportunity to educate. But, that's hilarious because back then it was like, well, if you don't have fertility issues, why would you go?
That is so funny. Oh my goodness. Oh, that's a great story. So let's get into some of the things that you help women with. But I mean, I'd like to kind of maybe back up a little bit and talk about, so we're gonna go forward and talk about, pregnant women and maybe postpartum and taking care of babies and those things. But what about before that, in the process of getting pregnant? Like I feel like right now in our society, our American culture, the fertility issue is pretty much an epidemic at this point of women and men struggling with infertility issues. So do you have some experience with that? Can you speak to that issue?
Yeah, thank you for asking me that. And I might get a little emotional because I really do have experience with that. My husband and I were on a 13-year roller coaster with fertility and trying everything under the sun. We did IUI, we did IVF, we were up for adopting a set of triplets at one point. We did everything to try to get a baby in our arms, and it wasn't meant to be. And it was such an identity changer for me. I thought that's who I would be. I thought that's how I would impact the world, was by being someone's mom. Yeah, here I am getting emotional about it. And that wasn't my path. And so one of the hard parts about that is that it's not just not having a child. It's not having grandkids. It's not having a future. It's not having someone to leave your favorite photos to, or it's a huge grief loss when that happens. And infertility it's a very private journey for many people. Some people like to share that with everyone and go that route. We started very publicly and then got very private as it got harder and harder. And so there are a lot of things that have changed since then. There's a lot of new advances in technology, so much more information. And I will tell you the things I wish I knew going into this, because there's so much of it where I thought it was all on me. We think about fertility, and so often it's like, well, what's wrong with her? What happened to her? Why can't she carry a pregnancy? And the crazy part is, what we miss out is oftentimes it's dad. As I said before, it takes two to tango. And we have to look at the health of mom and the health of dad before we start thinking about conception. And this, like I said, this is stuff I didn't even know. I'm a doctor, and we didn't talk about this, 15 years ago, 20 years ago, whenever that was. It just wasn't something that people had too much history with or research on, but we know better now. And so some of the things that we know is that the health of the dad-to-be will affect, of course, his contribution. So his motility, his morphology, his count, all are things that are healthy that we need to have a healthy baby. But also, one of the interesting things is dad's contribution will help create the placenta for a baby.
Wow.
And so the placenta has a lot to do, the health of that has a lot to do with dad's health. So the vascularization for that baby, it's not all mom. And that was a beautiful thing that I learned actually quite recently in one of my continuing education courses. Something else that I think is so fascinating to me is that in the opportunity where the egg is surrounded by sperm and they're all trying to get in, they all want to be the chosen one. She, for lack of better terms, she's the one who chooses which one it's going to be. She lets that one in, unless we're having twins, and that's another story, but she lets that one in. And that's important because when we think about things like IVF, there's a certain procedure there called ICSI. And when they do that, they're choosing, which is something we had to do because my husband's male fertility, had male factor infertility. And so that was something we had to do where they choose the sperm and they inject it into the egg. And if the egg was not having it, like that's not who she would have chosen, then that embryo doesn't succeed. And for some people, it's a great choice. It really is. And it's such a wonderful way to be able to get that baby in your arms. It just wasn't right for us. And had we known that so much relied on his health, we would have made different choices going into it. One of the things that we know now about his health is that he had some other factors that we could have cleaned up. We could have looked at his diet. We could have looked at lifestyle changes and choices. Some of the interesting things that we find with dads is the environment in which they work in. You know, are there chemicals? Are there diesel fumes? Is it construction where they're always around stuff that off gases? There's a lot of things that can contribute to challenges with that motility, morphology, and count.
That makes a lot of sense.
Yeah, it's crazy. So if we can look at what all is going on with dad, what all is going on with mom, create a plan ahead of time so that we're not trying to play catch up when we already have a couple that's been at it for 10 years. You know, yes, of course, we can still make an impact. We can still get you to the healthiest place you can be. So that if that baby is meant to be biologically yours, we can get you there. It's phenomenal what a journey that is. And I will tell you, if there are any parents out there who need just somebody to talk to on a parent-to-parent level, I am a parent of 4 embryos that have gone on, but I definitely am there with you and I can feel that and I can hold space for you. I'm happy to do that. So prepare early.
Yeah. So, okay. So you think the issues that we're seeing today with like the huge percentages of infertility, like the increase is just really dramatic, has multi-factors going into it. So we're not just looking at the mom, like you said, but we're looking at the dad. And then we're not just looking at, you know, a sperm count in the dad, for example, but we're looking at what they're eating, what they're around all day. So that's really interesting to think about, that really wide scope of all the factors that go into making you fertile.
Absolutely. And you know, you think back, just to be candid, on all those posters in high school that was like, don't have sex. If you do, you'll get pregnant the first time. You know, as that person, it was like, wait a minute. How did that happen?
Yeah, it's true.
Anyway, yeah, it was a comical point in which I could laugh about that.
Yeah. Okay, so if a couple makes it past that point and they are expecting a baby, what kinds of things should they be doing to ensure the health of that child and their own health during that pregnancy?
Absolutely. Great question. Lifestyle. Look at your lifestyle. What are you eating? What are you drinking? What are you bringing into your body? And by that, I don't just mean like food and water. What are you watching on TV? What environment are you in? Are you remembering to focus on gratitude? Are you remembering to have peace in your day? Are you remembering to calm the social media, set it aside, and cherish these moments that you have? Like, this is the only time that you will know 100% where your baby is.
Yeah.
They're with you, right? It's look at your relationship with your partner or with your husband or whoever is this baby's individuals, the humans, the adults that are going to be in their life after they're born. There's a great study that happened in Italy long before I was in school about the effect that happens to the fetus when the mom is upset with someone. So when she's pregnant, every experience she has, the baby's learning about the world through her. And so it's learning, oh, this is a safe person mom really likes, okay. So when I get out, I'm going to be BFFs with this guy. He's pretty great. Or that's not okay. I don't want to be anywhere near that person. I don't like that person. We don't like that person. I'm in solidarity with mom, not a chance. So the baby already knows coming out where's a safe place and where isn't a safe place.
That's fascinating.
Very important thing. Man, it's pretty awesome. So watching what you're bringing into your body. The other thing is chiropractic care. My goodness, I can't plug that enough. I've just blown away in my own experience with the moms that I see, the ones that I see from the beginning, and the ones that I see who come in, towards the end or third trimester where they're like, I can't sit. I have so much sciatica, or my baby's breech, or what do I do about this? And, I have so much pain. I'm having twins. I'm out to here. I'm in pain. And so having the moms all the way through, what a difference it makes in not just their pregnancy comfort, but labor and delivery, how fast they get their body back, how able they are to function with lactation, how much easier that seems to be for them. And then their babies, this is the super cool part. Their babies tend to be faster in achieving their milestones because they have so much neurological input their entire life. The baby's creating their inner voice from you. So you got 24/7 with this baby and you're connected, and everything that you say, they don't know what the words mean. Obviously, they're a fetus. They're growing, but they get the intention behind it. They get the hormones that come with it. They get the happiness. They get the serotonin. They get all that comes with it. So when they hear those words again later, it's that inner voice. And this is important because there are two, oh gosh, I could talk to you so long. There are types of dominant brains. For example, we'll just go into one right now for a lack of time. But a white matter dominant brain, which is our stereotypical female brain. Stereotypically, females are born with 10 times more white matter in their brain. Males are stereotypically born with 6.5 times more gray matter. There's always crossover. So anyway, we're going to focus on the white matter. White matter dominant individuals do well when they have language that's positive. And there's a difference in how we speak to ourselves. That how you speak to yourself in a positive manner is going to light up this part of your brain. And when that happens, it transfers over here. And this is why you're here. So like this is why Nicole is on this planet. That's what actually stimulates all the good things about me. That's where my creativity comes from. This is my personality. This is what I have to offer to the planet. But we can't get there unless we have that stimulated. So as a mama, speak to your baby like they're the most precious, most wonderful thing on the planet, because they are. They really, truly are. And they need those words, and you need those words too, because you're bathing them in all those good hormones. We need to do that. Oh my goodness. That was.
Yeah. I mean, I've definitely never thought of that specifically, and I've never heard anyone tell me that about, those parts of the brain, but it makes sense when I hear you talk about it, because the more I learn about health and wellness, the more I learn about how connected everything is, like with our emotions and our bodies. And so that just makes sense that it would be the same for babies too.
It's so cool. And my goodness, it's just such a magical time. I'm sorry.
Yeah.
Things about that. I'm trying to pick and choose. Something else that I would like to also recommend too, as we're getting closer to the labor and delivery, make sure that you predetermine what are your negotiables and what are your non-negotiables. And whoever is in charge of making sure that happens knows that this is what's okay and this is what's not okay. You might not be in a position where you can make those decisions. There are times when you might even be unconscious. And so you need someone who's trusted, that you can know. You go in knowing, you know what, if I'm unconscious or something happens to me, that in order to preserve my milk supply, my husband's going to make sure that they pump and give that baby the breast milk.
Yeah.
Wonderful. Great. There's so many things we don't think about, but just know your negotiables versus your non-negotiables. And just to touch back on fertility, same thing there. There's infinite ways to get a baby into your arms. And if you're on the struggle challenge with that, just decide with your partner, what are your negotiables and non-negotiables? Because there's so many different options. There's so many ways to get that done.
Yeah, that's great advice. You touched on breech, which is something I would love to hear you talk about. I don't know how common that is. I feel like it's somewhat common because I hear it talked about quite a bit and I'm familiar with it. So it must not be that rare. But how often do you have someone come to you that is breech, and what is the process of helping them look like?
I'm glad you asked that too. My practice is very specialized because I'm a diplomate in pediatric and pregnancy care. So I basically see the hard cases. I see the stuff that everything else seems to have failed for. And so I see a lot of it. I do. And it's possible that it's just me because that's what I do, but it's pretty common in my practice. And some of the things that we find with that is that there's an imbalance in mom. So I want to be 100% clear. I do not move a baby. I absolutely don't. That's outside of my scope. I also do not know where the position of the baby is. That is outside of my scopes. Outside of my scope. So I've made that clear. But what I do is I make sure that the mom's body is in the perfect position to allow gravity to take place, because that head is heavy and gravity will move that head down right where it needs to be into that vertex position. So we want to make sure that we remove all the obstacles in her body so that if that baby's not turning, we know there's a reason. There's a reason, like perhaps the cord's wrapped around their neck. Okay, and it's not safe. So if it's not safe for that baby to turn, we don't want it to turn. Right. We don't want to force anything. So that's why we always just address mom's body and allow for that opportunity to happen. And there's so many things that can cause that. My goodness, but you'll hear, from grandma or old wives' tales that, oh, don't reach up above your head, your baby will go breech. Or
I've never heard that.
With swimming. I've heard it all, I'll tell you. One, actually, I practice in a country in West Africa, in Sierra Leone. And when I was over there, I was talking to one of the moms, and moonbeams, you're not supposed to sit in the moonbeams because that will cause things too. And it's very real to them. That is very, very real. And so their perception is we don't do that. And if you do, that's what caused X, Y, Z. So hopping into that culture and jumping in with that, we don't sit in moonbeams. So that's important too.
Wow. Yeah, that's crazy. And that's a really good point though, is I've never thought about the maybe negatives of trying to move the baby around with the cord wrapped around the neck and things like that. So that does seem really wise to work with the mom's body and let things happen as they need to.
Yeah, thank you. I think so too. It really resonated with me when I was learning about it. I was like, yeah, that's perfect.
Yeah. Yeah. Mm-hmm. And then you see a lot of moms in fourth trimester then, right?
Yes.
Yeah. What's special about that time in the way that you approach care?
I'm really glad you're bringing this up. This is an underserved community, tremendously underserved community. When the baby's born, all the attention is on baby. Every bit of it. Everybody comes and wants to see the baby. I want to hold the baby. I want to give a present to the baby. It's baby, baby, baby. And that's great. But that baby needs to be with their mama.
Yeah.
That's what has to happen. The baby has so many intricate, tiny little things that are happening in their body and their growth and development. And they need to be next to mom. They need to be skin to skin with mom. They need kangaroo care. They need so much. And I won't dive into all that right now because I want to focus on mom. Mom needs so much. She just went to hell and back to get this baby here.
Yeah.
And to do it again in a heartbeat. But that's what she did. And so her body did all of these things. It had so many hormonal changes, the physical challenges that happen with all of it. Everything. Maybe she hasn't slept in 5 days. She's exhausted. And guess what? Now she's not going to sleep for several months now.
Yeah.
Going forward. She's not getting the help she needs. She might be home by herself for maybe 6 weeks if she has some pregnancy leave, perhaps. And if there's paternity leave, maybe dad's there. Maybe somebody's around to help. Maybe they're not. But you know what? This is such a big time to ask for help. That's one of the things I stress to all of my moms. And I talked to one of them today. I said, I'm going to be doing this podcast. And if you had someone to tell after all your experiences, because you're a mom of 4, what would you say? What's the one bit of advice? And she said, absolutely ask for help. This is my 4th baby. And I didn't ask for help before because I thought there was something wrong with me because I couldn't do it all. I was supposed to be super mom and I needed help. She said, it's so challenging at first to say, I just need you to take my kids so I can be alone with my baby, because it's like, how am I choosing favorites? or I need you to make a meal. And then I feel inept because I can't even make a meal for my own family. There's all those pieces that go with it, but it has to happen. You have to take care of yourself, because without taking care of you, you can't take care of your family. And we know that because they even know that in the flight industry. You get on an airplane, you got to put your mask on first if there's loss of cabin pressure. You have to take care of you. And they always say you can't pour from an empty cup. I disagree. You can, but at the cost of your health. It happens. And we all try to be Wonder Woman. We try to do everything for everybody, and we just can't do it. We have to say no, and we have to ask for help. The other challenge is that nobody talks to you in the healthcare world for 6 weeks. So you have your baby. You might have seen a lactation consultant for 15 minutes if you're lucky in the hospital or in the birthing center. Maybe you had a little bit more one-on-one time, but that's what you had. And then you go home. And then 6 weeks later, you're supposed to have your appointment where you find out whether or not you can have sex, and then have a great day. I mean, like, that's it. That is what we do as a healthcare community for our mamas, our brand new mamas. And we are so missing out on that. So at our practice, what we focus in on is making sure your needs are met. We put you through this questionnaire to find out where you are psychologically, what's going on with that. And that's hugely important. And I told this to you earlier. I was embarrassed not knowing this statistic before I found out about it a couple of years ago. But I mean, I've taken care of hundreds of moms. 1 in 5 moms has postpartum depression. 1 in 7 moms actually thinks about hurting themselves or hurting their baby, and 1 in 12 will do it. They'll go through it. Are you kidding me? I mean, how many moms do you know? How many friends do you have? Who's suffering and isn't saying anything? And then why aren't they? They're not, because there's that fear of, well, you're going to take my baby away from me. Or it just happened once when I thought about I could just run this car into the phone pole and everything would be fine. Oh, no, but that's the time to reach out. And reaching out means call somebody and say, hey, I just had weird thoughts. That's normal. That's okay. Let me say it's not normal. It's common. It's okay. Thank you for reaching out. Let's get you some help. And that might mean we get you a nap, or we get your diet tweaked a little bit, or we just get you somebody to talk to, or, someone to hold your baby so you can take a breath, whatever it might be. Let's get a shower. Let's get you some assistance here, because we're all in this together. We're here to help raise this baby. They always say it takes a village. It does. But we got to take care of this mama first. Her priority needs to be the baby. Everyone else's priority needs to be the mama. Mm-hmm. And one of my best advice that I give my patients, and I truly love this one. I heard it and I laughed so hard. When your baby sleeps, you sleep. When your baby eats, you eat. And when your baby does laundry, you do laundry. Love that.
No laundry is getting done. That's great.
It's happy, healthy children far supersede a clean and tidy house. I mean, it'd be great if you could have both, but sometimes you can't. And the children always need to win in that case.
Yeah. I mean, mental health for moms it's a sad topic to talk about because it's such a struggle. And I'm just thinking, as I'm listening to you, that if I had learned as a new mom how to ask for help and how to talk to someone when I was struggling, with anxiety or depression or whatever it might be, or just feeling overwhelmed, how much that may have helped me in the following years, as a mom. You know what I'm saying? You can build that skill of taking care of yourself and asking for help. Like, that's going to help you exponentially going forward.
Absolutely. And there are a lot of mamas who don't know how to ask for help. And so for all of us out there who know a new mom or mom to be, they may not know. We call up and we say, if you need anything, let me know. I'll be there. Absolutely. Or, thoughts and prayers for you. That's all. That's great. But maybe she doesn't know because she can't even think straight to ask you, hey, can you pick up Billy from school on this day? Or I need someone to get the dry cleaning or whatever. So one of the best ways that we can do something for them, we could get a DoorDash card, or we could do a meal on our own, or we could go over and do laundry for them. We have all of these things that we can do. Think of the things that are on a daily basis in your house.
Right. And just go do them.
Exactly. And so the way to ask is today better for you or tomorrow? Mm-hmm. I'm coming to do this. Which day works better for you? There are some people, though, who prefer to be very private. And so you kind of need to know your people when you make that offer. But just offer, this is what I can do when works best for you. That's a super important thing to do.
Yep. I love all that. This is really good thing to talk about. I hope that people listening just find a lot of encouragement in that. And no matter what part of the process you're in, like if you're in the midst of that, like postpartum, really hard stage, or if you're in early pregnancy, or maybe you're trying to get pregnant, like tuck that nugget away in your head and remember it for the appropriate time. But this is a really good thing to talk about because it's not talked about enough.
I have 2 other bits I wanted to share with you too that I was thinking about around pregnancy and children. And yeah, let's talk about the couples who were not expecting to be expecting.
Yeah.
This is a surprise. And how do you navigate that, right? So again, knowing your people helps, but sometimes you don't. And in my position, I don't always know. So when they come in and they're a first-time parent, or maybe they're not a first-time parent and this was just an unexpected thing, how do you navigate the congratulations versus, oh, okay, all right, let's create a plan. How do we go forward? And so get curious and ask questions that are gentle and loving. A wonderful question is, tell me more about that. Tell me what you think about that, anything like that. So tell me more, get curious, ask those leading questions, and then you'll start to see, okay, is this something that, maybe it wasn't expected, but they're super excited about it and everybody's giving them a hard time because they're like, well, you're not married yet, or whatever their situation is in their family or in their lifestyle. And instead of coming down on them all the time, they just want someone to congratulate them. Like, this is a human life that they're growing and they just want that support. So that was an important one. And then the other piece is what happens when you are either in pregnancy or you've given birth and you find out that your child now has high needs, or what we call special needs. What then? There is a grief process that goes through that, or that we go through when we have that. It's an important piece, and many people are afraid to grieve that. You grieve the loss of that quote unquote normal family that you thought you were going to have. I mean, and we all know normal is just a setting on a washing machine, like, because that's just is what it is, where no one's normal, right? But you have this fantasy often when you're pregnant, this is what it's going to look like. And now your reality looks different than what you thought it would be. And anytime that's the case, where we have that difference between what we expect and what reality is, there's a grief process. So give yourself an opportunity to grieve that, deal with that. It's okay, because that's going to make you the parent you need to be for this child who has more needs from you than maybe the baby you thought you were having.
Yeah. So giving yourself permission to grieve and adjust to this different life than you were imagining.
Yes. It's such a beautiful life, but we can't get there to appreciate it fully until we've processed the grief behind it.
Right. Yeah, exactly. I imagine that in some ways. I can be a bit like idealistic, and I'm very much a planner. So I can see how I would need that time to grieve and just like get my brain, like wrapped around a different plan.
Absolutely. Yeah. You made me think of one other thing too about dads. I was thinking about that. Sometimes we miss out on the conversation around dads. And dads are half the plan here. We talked about at the beginning, it takes 2 to tango. So we have dad support here as well. We have this group called Your Circle, and it's just a group of like-minded folks who want to talk about, options for raising their families. It's moms, it's dads, it's caregivers, it's grandmas in our group, but it's people of any walk of life that are raising children or doing something for kids. And so we have this group that gets together. And that was the first complaint I got from the dads is, when are you going to do something special for us? And I this was years ago. I'm glad to know it was years ago and not just 10 minutes ago, but where I was like, oh my gosh, you're right. Because often you get stepped aside. And so here's the crazy thing that happens, or one of many crazy things that happens in bringing a baby into this world. So when you're pregnant, you've got 24/7 with this infant. And it's wonderful and life is great. And you have this baby growing and you're BFFs because you're always together. You've bonded. Yes. It's like nobody's business, right? But dad's on the outside, like, hi, over here, hello. It doesn't really have that connection with baby yet in any way that you do. It's a very different bond. He's like, yeah, okay. But I have this connection with my woman here. Okay, she's my girl. Love her. I'm connected to her. So as the dad, let's say we go into a very challenging birth situation. I'm here to protect her. And I see this baby as a threat to my wife or to my gal here. And I am not happy about this baby because this baby is hurting her and I love her. I'm bonded to her and I don't have that bond to the baby. And that can throw things into a very different cycle.
That's really interesting.
Can change how they bond later. So that's another important piece too. And the father, this is something that I love too. It's amazing how our bodies are made. So when the baby's born and the dad finally gets to hold this baby, what do we usually see? We usually see this. Baby puts that little hand right around the finger. It's one of my most amazing moments that I love to see. Any time I've ever been at a birth at my own family, I just like watching this. And so the moment that happens, that's when the bonding happens. That palmar grasp reflex is for daddy. That's what that's for. So that happens and dad's body changes from there on out forever. So his testosterone level comes down a bit and he gets this huge rush of something called vasopressin. And vasopressin is very similar in bonding to like oxytocin. So oxytocin, as women, we get all that. We get the bonding. Oh, I love you. So great. Yes. They get vasopressin. And vasopressin is, I will guard this with my life. This is mine. I will protect it. And so anytime they're around their child, like that's what happens. It has that rush effect. So even if it's 20 years later, they still have okay, I'm less likely to take you down because my testosterone is a little bit lower and I want to protect you. And it's phenomenal, but it doesn't happen unless this happens.
Wow.
Isn't that amazing?
That is amazing. Yeah. I love how our bodies are designed to connect like that.
It's so cool. I love everything about this. I'm sure I could go 6 more hours on it.
I know. That's what I was thinking too. I was like, we really could. I could go into detail on so many more things, but if we were going to wrap it up, one thing I want to make sure I get out of you, I ask this to every podcast guest actually, and it's what healthy living resource would you recommend to the listeners today? So if you have resources that you want to share, I would love for you to share that. And if anything else comes to mind as well, if someone wants to learn more about any of the things that we've talked about.
Excellent. I would definitely say for the fertility piece, there are 2 things I'd want you to know. Number one is there's a book, I believe it's by Toni Weschler, could be Toni Weschler. It's been a hot minute since I read that, but it's called Taking Charge of Your Fertility. It's absolutely excellent. I'm telling you, I'm a doctor. I actually, in Oregon, I'm considered a primary care provider, and I had to go through and learn all of the wonders about gynecology and the things that go with that. Even after all of that, I learned a tremendous amount about my own body from reading this book, a tremendous amount. So from everything to like knowing your body, like knowing when you're ovulating and when you're not, and why some women do this and some women do that. How do you know your body? It's pretty awesome. The Schaefer protocol is another amazing asset. Dr. Marcia Schaefer, she's actually out of Wisconsin, the Madison area. I can't remember exactly which little town, but the Schaefer protocol, I would look that up. That's helpful in preparing your body to get ready for this pregnancy that you are to have.
Okay.
And locally here, we have some great assets for our high need kids. So look in your area if you don't live in our Springfield area for great occupational therapists, physical therapists. We have this awesome place called Dynamic Strides here. And they focus on helping children of all abilities to be able to function the best that they can. They've got hippotherapy there, which is with horses. That's a whole great thing too. And then one other thing I want to touch about on postpartum depression is reach out to anybody. They are your healthcare resource. Anyone that you trust and love, just reach out to somebody. That's the most important thing you can do. Just anyone at all. I'm sorry, I can't stress that enough. Ask for help if you need it.
Yeah.
Oh, and let me just plug our Pathways group again. Yes. So if you're in Springfield, we have the group called Your Circle. You can look us up on Facebook. It is a private group, so we will have to let you in to that. It's not one that's public, and there's a purpose behind that. It's so that people can feel comfortable sharing everything that's going on, and that's respected within our group. But there are Pathways Connect groups, which that's what our Your Circle group is, all around the world, actually. So you can look up at the ICPA, so those letters, and then the number 4, KIDS, so ICPA for kids. And that website is a great place to find a doctor. So you're going to find a chiropractor there. You want to look for someone who knows the Webster technique. It'll be delineated on there if you are pregnant and maybe having some concerns about the position of your baby. You want someone who's either a CACCP or a DACCP for your other needs that you have for pregnancy and pediatric. But I will tell you, even if they're not, if you've got a practitioner that's listed on that website, they are reputable, they know what they're doing, it is definitely somebody to go to. So if you've got the choice between someone who doesn't have that degree and they're 5 miles from your house, or someone who does and they're 250, you kind of have to make the decision, who do I go to? Yeah, you're not going to be in bad hands at all. Going to anyone who's on there is my point. They're fantastic. I would check that out. The reason I brought that up is because you'll see on there, it'll say PC next to their name, and it's Pathways Connect. So they host a group.
That's amazing. I love that. Thank you. I'll make sure I put all of that and your contact information and everything in the show notes for everyone. My second question is much more lighthearted. What is your favorite healthy snack?
Oh, my goodness. Well, right now it's actually sweet potato chips that are fried in coconut oil. I think they're called Jacksons. I eat them all the time. I just now started to sprinkle them with garlic powder and onion powder, maybe a little bit of herbs, but yeah, I'm hooked. What's yours?
I really love my homemade yogurts. I have raw milk delivered to the house, and I take some of that and make yogurt, and that's probably one of my favorite snacks, with a little bit of honey and like some kind of fiber on there with chia seeds or hemp seeds or hemp hearts, and then berries if I have them. That's my go-to.
Awesome.
I know I feel like it's a little bougie for a snack, but
this homemade yogurt that I made with my raw cow's milk.
Yes. But the real reason I make homemade yogurt is because I have 4 kids and the 6 of us eat so much yogurt. Yeah. It is really expensive to buy good yogurt for the 6 of us. And very easy to make in an Instapot. So there you go. Is there anyone that you would like to see as a guest on the Daily Wellness Podcast?
I would say probably a biological dentist. I would like to do that. I would like to know more about that for the public. It's not something I even knew existed until maybe 10 years ago.
Yeah. So we do have one episode with Dr. Roberts on here. He came on here, but it was kind of like a conversation with you where I could have like picked one of the topics that we just barely talked on and gone on for like another hour. So I think another episode is
part 2.
Awesome. Well, thank you so much for your time. I'm really excited to get this message out there and have everyone benefit from your wisdom. Thank you.
Thank you. Appreciate you asking.
Hey, really quick before you go, we're about to head into the holiday season, right? We have Halloween, Thanksgiving, Christmas, New Year's, and with all of the fun also comes lots of opportunities for sugar and junk food. One way that I try to be mindful of my health and my family's health during this time is to, have treats on those special occasions, but all the in-between times when there's something exciting happening or good happening that we want to celebrate, to find ways to celebrate without junk food and without sugar. I put together a guide for you that has 30 different ideas. So when you want to celebrate something over the next few months, you can just look at that guide and you have all of the ideas right there for you. A link is in the show notes and you can get it for free. Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.